And we are joined right now by Dr. Abrar from Stanford Health Care to discuss this latest surge and the response. Good evening, doctor. Are we going to have to return to mask mandates again?
Well, if we do, and I think that, as cases are rising, this is again the time to focus in on where spread is most likely to happen. Crowded public transit where people are packed in together, that was one of the most recent areas that was sort of nixed by a judge, not by a public health official, and was really against the recommendation of the CDC, right? The CDC said, keep this in place for a crowded public transit where people have to go, they have to congregate, and where infections can spread easily. So if mask mandates come back, I expect that counties are going to put them in place, particularly in crowded public transit.
But what is your overall feeling about where things stand right now? A lot of professionals, medical professionals, are saying, well, we've got so many tools in the toolbox now. You can either, deal with prevention or we can deal with treatment, but, it's not like it was. Where do you stand?
Well, I've worked both on the clinical side, right, taking care of patients. I've been doing that for the last few years since the very start of COVID, and also worked on a public health response. When I worked in Massachusetts, I worked on the Massachusetts state COVID response. Clinical medicine and public health are very different. There's different problems to be faced. And while I agree that on the clinical side, we have better tools, we have antivirals, we better understand this virus than we did previously, although there's still a lot to learn. From the public health standpoint, I can say that our most vulnerable populations don't have all the tools. They don't have all the means that people that are well connected to the healthcare system have. And frankly, if we're not all protected, then we all remain vulnerable as our frontline workers, as vulnerable as those who don't have primary care doctors, those who can't take time off of work, those who can't isolate safely. The virus will spread. And remember, it's not just about what we're dealing with right now. As the White House said, later this year, we're expecting up to 100 million Americans to get infected in the fall and in the winter. What about then?
Doctor, I mean, everyone has COVID fatigue. And so it makes sense that, when you see a light at the end of the tunnel, well, you're going to just, go for it. Are we kind of suffering from wishful thinking here that we've already kind of crossed over into that idea that it's an epidemic and no longer a pandemic, although it just seems like semantics? Do we need to frame this differently so that people can protect themselves again? Better?
Yes, we do. So that two things can be true at the same time. It is true that we are better off now than we were early in 2020. We have more data on how to treat patients. We have more ways to keep people alive. We have excellent vaccines, which everyone should get vaccinated. Everyone should get boosted, and we have a long ways to go on boosting still. Now, what is also true is that immunity wanes over time. We have seen now the coronavirus, it mutates rapidly. They're spread all over the world. Many people globally have not been vaccinated. We're seeing new variants popping up every few months. Many of these have been very transmissible, so they transmit more easily than the previous variant. Aside from Delta, we haven't seen that they're more virulent, meaning causing more severe disease, but that doesn't mean that that's not possible or that won't happen later this year. So again, focus has to be on prevention. And this is not just about what individuals do. This is about what businesses do, about what the government funds, about what the states fund. What are we doing about ventilation, cleaning the air in shared public spaces? Yes, getting people to wear high filtration masks is important. It's definitely part of this. What are we doing for paid time off? What are we doing for creating safer isolation centers? There's a lot of pieces here that go beyond just what an individual can do.
Well, you listed a whole list of what are we doing, and we're not doing a lot on a lot of those things you just listed. So where does that leave us?
That, to me, is why I keep advocating, keep pushing, trying to connect with people in the federal government and our state government, pushing forward. We've been writing op-eds. We just had a piece out in LA Times talking specifically about ventilation, what needs to be done. We have a little bit of time, but not a lot. And so if we do nothing or if we move slowly, we will be caught off guard once again. And, it's a very depressing thing to admit that, but most of us in public health are worried about this.
Do you foresee, and I know we're running out of time, a future universal vaccine so that it covers COVID-19 and perhaps any other variants that come along, and maybe it lasts a little longer?
We're hoping for that, and certainly pharmaceutical companies are working on this. As COVID coordinator, Dr. Ashish Jha has been pointing out, we need Congress to really move forward on funding, right, so that we can secure the best antivirals, secure the best vaccines, both in the U.S. and for people abroad. So yes, while that is going to, that's where things are headed, we also need to make sure that we can pay for that and be prepared.
All right, good information. Thank you so very much for joining us, Dr. Kerr from Stanford Health Care. Have a good evening.
Thank you.
Thank you.